Hey skin enthusiasts, Dr. Afton Cobb here, dual board certified dermatologist and Mohs surgeon, and today I'm going to talk to you about Botox. So really what I'd like to talk to you about is what the side effects are of Botox, what can go wrong with Botox, and things you should look out for. So before I get started, hit the subscribe icon so you can stay tuned to my YouTube community. Make sure to hit the little bell icon so you can get notifications every time I post a new video. So now I'm going to talk about the potential side effects or risks of doing Botox. In the world of cosmetic procedures and treatments, I would say that neuromodulators like Botox are some of the most safest that you can do. We've used them for a very long time. Even though Botox was first approved for the treatment of glabellar lines in the early 2000s, Botox has been around since the early 1970s and used for all these other medical treatments. So we've been using it a very long time, and in general in the practice of medicine, when we've had something around for a longer time, it's nice because it's safer, because we understand it better, we have long-term data on safety and efficacy, and so I consider the neuromodulators, particularly Botox, to be quite safe. The main downsides that you can get after treatment, like we talked about, a little bit of pain with the injection, you might get bruising, you might get headaches, but that's really about it after the injections. The next downsides that could occur are related to where it's placed in your muscles. So if you have someone who doesn't know what they're doing or it's used the wrong way, the worst thing that could really happen is you end up looking kind of funny. For example, if you inject too laterally, like out here when you're doing the brows, and too deeply, you can hit one of the muscles that helps open the eye. And you might have seen this in popular media. Sometimes people share their stories where they get lid ptosis, where like the eyelid just won't lift up, and that's because it's been knocked out from a neuromodulator. And there are eye drops that we can use to put in the eye to kind of try and help stimulate that muscle to make it go up so it's not as noticeable. And again, Botox lasts about 3 to 4 months, so even if you look kind of funny for 3 to 4 months, at least it's temporary. It's not going to last forever. Another thing that can happen if neuromodulators are placed too low on the forehead, or you don't do the glabellar complex as well, you can cause dropping of the brow. And I talked about that a little bit earlier, because if we're knocking out these forehead muscles that usually pull the eyebrows up, when you knock them out, it brings it down. And that can be a problem for people who really rely on their forehead muscles to keep their eyes open. And by that, I mean some people get these kind of droopy eyelids where the skin hangs and kind of folds over the eyelid, and it happens to a lot of people. It's very common as we get older, and as a result, they use their forehead to open the eye to try and get that loose skin up so they can still see. And so if you inject someone in the forehead who has that problem, they're not going to be able to open their eye as well. So it's something that we're always looking for and assessing when someone comes in. And if someone does have those loose lids here, I'm probably going to recommend that they see an oculoplastic surgeon or someone who knows how to do a blepharoplasty to take care of that excessive upper eyelid skin. Another thing that can happen when you do injections into the masseter, if you're not deep enough or you're too far anterior, sometimes you can knock out the muscles here like the risorius and knock out the ability to fully smile. If you do it too low down here, you knock out the zygomaticus, which helps draw the smile up, so you may not be able to smile as well if it's incorrectly injected here, right here. Similarly, when doing injections around the lower face or the vermilion border, if you use too much or put it in the wrong areas, you can get inability to pucker the lips or move the lips as well. You can get drooling, you can get facial asymmetry. So a lot of the risks with Botox are just temporary, and also just in how your facial expressions will look for a while. I hope you found this video useful. If you did, make sure to hit the like, subscribe to my channel, and hit the notification bell so you can get updates whenever I post new videos. If you have any other questions, feel free to drop them in the comments. And I just wanted to remind everyone that, you know, even though we talk about all of these wonderful benefits and there's a lot of pressure in the media and amongst our peer groups that make us feel like we have to be doing all these things to be beautiful. And the thing is you don't, and I hope that in this video it didn't make you feel like, oh my god, I have to go run and start getting this and spend, you know, anywhere from $300 to $700 every 3 to 4 months. I think it's something that you have to weigh carefully with your financial situation and with you know, how important it is for you. I think that we can all be beautiful without doing all of these procedures, and a lot of beauty comes from how you treat other people, how you show up for the world, how you show up in the world, how you treat people, how well you treat your body with good lifestyle and exercise and healthy foods and doing good sun protection. And you can do all of these things and still have a really radiant, youthful glow as well. So if you listen to all this and you're like, wow, I'm feeling pressure to do it, I hope you don't have that pressure. Certainly not from me, but hopefully it answered a lot of the questions that you have about it. That's all for this video. Hope you found it useful. If you liked this video, make sure to hit the like button, share it with your friends, subscribe to my YouTube community, and make sure to hit the little bell icon so you can get notifications anytime I post a new video. If you have more questions about Botox, make sure to check out my other videos. I have one that discusses what Botox is, what the uses are for Botox, and I have another video that talks about when to start using Botox and what you can expect when you go in for treatment, as well as what you can expect with the results afterward. And if you have any other questions, feel free to drop a question in the comments below. Thanks so much. Hope this information was helpful to you.